So we'll begin by outlining the path of the axillary nerve through the brachial plexus. So we'll do roots, trunks, divisions, cords, and branches. So the brachial plexus goes from C5 through T1. And the axillary nerve begins from the nerve roots of C5 and C6, and then goes along the upper trunk before going down the posterior division. And then it goes through the posterior cord. Before branching out to the axillary nerve.
So I'm going to draw out the axillary nerve and talk more specifically about what the nerve innervates. So we're going to look at the branches column from what Jimmy just talked about. So we have the roots, and the axillary nerve kind of branches off, so it goes into an anterior branch. And part of that branch will innervate the skin of the deltoid, or the lower half of the deltoid. While another portion of it goes to the muscle itself. And so then we have the posterior branch, which also goes to the deltoid, but there's another part that wraps around, and that goes back to the teres minor. So there's two branches that make up the axillary nerve, so it also sends sensory information via the skin back up to the CNS, but it's primarily innervating the deltoid and teres minor. So here we have a 3D representation of what we just talked about on the whiteboard. So we have the orange pipe cleaner here with its various branches signifying the axillary nerve. So it comes in through the armpit and wraps around posteriorly around the humerus. And so we have this lower portion would be the cutaneous portion of the axillary nerve, and that's sending the sensory information from the lower half of the skin in the lower part of the deltoid. This top part would be the anterior portion that's innervating the deltoid itself, and in the back we have the posterior branch of the axillary nerve, and that's innervating the teres minor.
So now we've added some of the vasculature that accompanies alongside the nerve. As the axillary nerve wraps posteriorly around the humerus, it is accompanied by the posterior circumflex humeral artery, which is the yellow pipe cleaner here. The posterior circumflex humeral artery is a branch of the axillary artery, which is in the purple. The axillary artery also becomes the subclavian artery at the more superior you go.
Okay, so here we have a 3D model of the axillary nerve. So here you can see in the pink the posterior branch going to the teres minor, here in the green. And then we also have the anterior branch coming to the various parts of the deltoid in the front. So the orange part is the superior branch. The yellow here is the inferior branch, and then the purple is the cutaneous branch going to the skin, receiving sensory information. And then we can also have mechanisms of injury to the axillary nerve, such as trauma. So if they were to break the humerus, it can cause injury. Also, improper use of crutches can damage the axillary nerve. So dislocation of the shoulder can cause injury.
Damage to the axillary nerve can lead to sensory and or motor function loss. Loss of sensation happens in the inferior region of the deltoid and can lead to a feeling of pins and needles in that area. Loss of motor function can happen in either the teres minor or the deltoid. The severity varies depending on how bad the injury was, and it can lead to either weakness and or full paralysis. This weakness and paralysis can lead to muscle atrophy, which enables clinicians to easily be able to feel the deltoid tuberosity on the humerus. It can also lead to the inability to abduct the arm.